I've only been here, so I can't speak to its beauty compared to other parts of the USG. But there is a reason I've been here for 11 years, and a big part of that is because of how great the community is and how welcoming they've been to me. So on a typical day here in Mistissini, the least amount of positions that we would typically have staffed here would be about 5. That's at a minimum. At the most, we could be about 8. And our whole team is comprised of approximately, I'd say about maybe 15 staff that work in different amounts. When a trainee comes here, to give them a sense of the type of things they're going to be seeing, they'll be spending a lot of time in our emergency room, which technically, in the eyes of the province of Quebec, is a walk-in clinic, though sometimes we'll intubate somebody, sometimes we will put a chest tube in, or deliver a baby there. So that's one aspect of it. There will be a lot of exposure to our prenatal population, our pediatric population, well baby clinics, as well as our postpartum population, in addition to our adolescent medicine clinics, which are primarily geared around individuals who are just diagnosed for the first time with a chronic disease, as well as individuals who struggle with issues of mental health. And finally, opportunities to see patients in our home care clinics, as well as even have some brief exposure to our hemodialysis unit here. So as you can see, it's extremely diverse. And within that group of clinics and departments we have, pending sort of the trainees' strengths and their interests, we can scale up or scale things down, depending on where they're at and kind of where they want to be. The volume of staff here impacts the clinical decision-making process for someone who's just gotten here for the first time a little less than the lack of resources, I would say. We can't just call cardio and they run down. We have to call them and put them on FaceTime and send them pictures of EKGs. And I would say one of the hardest things for me when I first came here was establishing trust in the community and me as a healthcare practitioner. Historically, people like me have caused a lot of harm here to the individuals of the people of Mistissini and the USG, and they're extremely reticent to see someone new who's their physician who looks like me, who is like me, and I think that was difficult for me to gain their buy-in in me as a professional, and it took me meeting them where they are, going outside of the walls of the clinic to try and integrate more into the community and gain their trust, such that now people actively seek me out for a visit, for an appointment. And I think that's challenging for every new staff that's here who is not Indigenous, because just the centuries of colonialism and cultural genocide that people like us have sadly caused to the people here. And we have to default to the fact that we are visitors here, and we have to adapt to what the needs of the community are. And it's a continuous path of growth, a continuous path of learning, and to sort of be prepared for that.